Hey, I may not look mad, but I am. This video is about anybody who practices medicine for the money. And the reason I made this video, I'm not going to tell you because it's very confidential and I'm not going to go there. But I have the right to make a blog, and I'm going to blog about it today. I was going to type it on a MySpace blog, but I'm going to talk about it now because it needs to be addressed. I'm tired of people practicing medicine just for the money and not for the patient. I'm tired of patients being mistreated, and I'm tired of other people in the medical staff being looked down on because they don't have a higher license than the other. No doctor is better than any physician's assistant, and no physician's assistant is better than a registered nurse, and no registered nurse is better than the LPN, and no LPN is better than the CNA, and no CNA is better than the medical assistant. We're all in it together to help the patient. If it wasn't for patients, there would be no hospitals, there would be no clinics, there would be no dispensaries and dental offices, and if it wasn't for patients, God forbid, people get sick every day, and it's not good that they get sick, but that is what we are there for. We are not there for the dollar, even though the dollar might help us to pay bills. In the end, if you are not there for the patient, then you are wrong, and you don't deserve your license. And people like me who are trying to climb up to the top and get the registered nurse's license from the level that I am now in nursing, we deserve it more than you do. I'm tired of other nurses thinking they're better than other nurses because of their title. A title don't mean nothing. It's just a piece of paper. If you don't know what you're doing, or you're not there for the reason that you were sworn in as a nurse to be, you should not be a nurse. But I know you ain't going to turn your license in because you want the money. I'm tired of doctors throwing medicine at people and don't know what the hell they're doing because they're so ready to go home, but they're not there for the patient. The patient comes first, and their needs are what we're there to attend to. And there's a shortage in America right now of nurses. There's always going to be a shortage because you can never have too many nurses and doctors, but there is a big nursing shortage. And no matter how quickly we fulfill that shortage, we're always going to be short of good nurses because all the nurses aren't in it for taking care of the patients. So until that is fulfilled, we'll always have a shortage of nurses. I don't care how many doctors offices and hospitals and clinics we fill up. Until you're there for the patient, then you are wrong. And that's all I have to say about that.